My name is Kenneth J. Doka, and I'm a Senior Vice President for the Hospice Foundation of America and Professor Emeritus at the Graduate School of the College of New Rochelle. Most of my work has generally been on grief and loss, but I've done some work with hospice. What originally got me interested in is when I first started working, I was really interested in delinquency, in juvenile delinquency, and I had to do an internship, a counseling internship. The one I had dealing with delinquents sort of changed midstream when the supervisor moved to a hospital care. And so instead of working with delinquents, I ended up working with terminally ill children and bereaved parents. I was counseling with them. So, I was right in the heart of it, working with the families and the staff and the children. Recently wrote a book on end-of-life experiences, extraordinary experiences at end of life. With the Hospice Foundation, I co-edited a book on prolonged grief disorder. Prolonged grief disorder is a diagnosis now in the DSM-5 TR that represents an advance in the field and that we're beginning to acknowledge, at least in the last DSMR. And the DSMR is the diagnostic manual, really, for therapists and the like. The DSM-5 in general, and particularly the TR, the revision of it, really are recognizing that grief can sometimes be a very complicated process, and that's been a very healthy understanding. Most people no longer hold to a stage theory of dying. It's not one of the most common approaches. I think if you're grieving, the first sign is always if you think you probably need to see a therapist, you probably do. And if for nothing else, then to simply validate and say, no, you're just experiencing grief as it really manifests itself. However, I think obviously, if you're self-destructive or destructive of others, if you really can't function after a period of time, then it's time to go and see what you're really struggling with. It might be prolonged grief disorder, it might be depression, it might be anxiety. There are a number of different diagnoses now that are available for people who are struggling with grief. Well, grief is simply a reaction to a loss, and that reaction to a loss can take place on a physical level, any of the above, physical level, cognitive level. Grief affects us cognitively, it affects us emotionally, it affects us physically, we may feel physically ill, it affects us spiritually, and it affects our behavior. And the grieving process is simply a process in which we try to deal with and reintegrate the experience of loss into our life so that we can fully function in the world. I would define bereavement as the objective situation of a loss. So if you're a bereaved child, it means your parent died or you lost your parent in some way, maybe through abandonment or whatever. Bereavement is an objective term. Grief is more of our reaction to it. The grieving process is that intrapsychic process by which we try to come to terms with our loss. Some people also call that mourning, like Therese Rando. Others reserve the term mourning to refer to the rituals that we use around death and dying. Part of my work on disenfranchised grief has really brought to the fore the fact that we mourn lots of things other than death. And I think it's interesting to note that most scholars would consider Freud's essay on mourning and melancholy to be the beginning of psychological work in the field. And one of his cases that he discusses is a bride abandoned at the altar. And I think he was trying to teach us an important point there, that grief is not just about death, it's about loss. Disenfranchised grief refer to losses that are unacknowledged by others. They're not publicly mourned. They're not socially sanctioned. So it can be, for example, sometimes because the relationship's not recognized, let's say with an ex-lover, maybe, or a lover, rather than a spouse, it may be. Because the loss, like the death of an animal companion, is not recognized. It may be because the griever is not considered capable of grief, like somebody with dementia. It may be because we grieve in different ways, and the way that the person grieves is not consistent with what the norms of that society are and how you should grieve. It may be that certain deaths are so full of shame, like suicide, that people may be reluctant to share their stories with others. So it can be disenfranchised for a lot of different reasons. I don't know that there are other findings specifically as insights that we really have to, that our role is to enfranchise grievers, to recognize that people respond to different losses in different ways. And I think it behooves us to be non-judgmental as we let people describe what the loss means to them. For some people, loss of job may simply be a minor inconvenience. For other people, it could be a devastating blow to their self-esteem. So I think what disenfranchised grief reminds us of is it reinforces the lesson of the very individuality of loss. I think the more that there's, kind of writing about it, the more that we look at and do research on different kinds of non-death losses, as Darcy Harris has been doing, all of those things are extremely helpful. The work that Terry Martin and I have done on what we call grieving styles, which started out as gender studies, which started out to say, do men grieve differently than women? And the answer we came up to is pretty naturally, some do and some don't. But we really kind of tried to build on the notion that there are certain grieving styles, and it's a continuum. And on one end of the grieving style are people who experience grief with strong emotions, strong emotional responses, and that comes out as they express their grief, often mirrors those inner emotions. And the best way for them to adapt is to explore, their emotional suffering and their emotional pain. But on the other side are what we called instrumental grievers. Instrumental grievers often experience grief more cognitively and physically, and express it more in their thinking and behaving, and that's what helps them. So again, all of this work on gender really shows that gender is a factor in grieving styles, but culture is, and background is, and temperament and socialization, that there are a lot of factors that influence how we grieve. But again, it reinforces the very individuality of how we experience loss. To just recognize we all grieve differently. As I said, the intuitive style is more cognitive, more behavioral. People are likely to do things to express their grief, maybe run a race in memory of the person every year, or something of that nature, do a fundraiser or something. That's their way of expressing grief. On the other side of the continuum are intuitive grievers, who will often find counseling very, very helpful. In the middle are what we call more blended grievers, and then there are sometimes dissonant grievers who really are repressing their emotions. But not everyone who doesn't show emotions is necessarily repressing it or dissonant. In some cases, as we say in the book that Terry and I wrote, that these feelings are more pastels. Their emotions are more pastels than the vivid colors of intuitive grievers. Not that they don't have them, but they're not as deep and as widespread. Again, I think one of the things that we're doing at the Hospice Foundation is doing a program next year on things that really can facilitate meaning-making in the dying process. So we're looking at some of the innovations, the approaches like dignity therapy, and some of the other things like legacy building that may really help people as they are dying. I've also always been interested, although I haven't had a chance to really fully explore it yet, on generational differences in grief, how different generations deal with grief. So those are two areas I'd like to write on and research as we go on. Dignity therapy is a therapy designed by a physician called Chokanoff, and it's a legacy approach. And one of the things we found is we all like to think that when we leave this world, we have left a mark. And we believe that when people are dying and they feel they've made a contribution or they've had some influence, that facilitates the dying process. So these are activities like reminiscence and life review that help people do that. I think in this field, if you're going to be doing significant work, you probably need, other than volunteering, which can be very significant, I think it's best to get started, probably do a number of things. One is join ADEC, the Association for Death Education and Counseling, go through their certification process, because that'll give you a good grounding in what we currently know about death and dying and the like now. End-of-life care is pretty diverse. You have social workers, you have chaplains, you have counselors of various sites, you have nurses. It's an interdisciplinary field. So there are lots of different ways to enter into it from a variety of different fields.